Do you know, what is alcohol withdrawal syndrome? A group of symptoms that develop when a person suddenly limits or stops consuming alcohol after a long period of continuous drinking. Welcome to RN Amir campus to learn differently. Alcohol withdrawal syndrome is of the following types. 1. Minor withdrawal. Symptoms include anxiety, nausea, and vomiting. It occurs around 8 hours after the last drink of alcohol. 2. Major withdrawal. Here there may be hallucinations and hypertension. Symptoms occur within 24 hours after the last drink. 3. Withdrawal seizures. It usually occurs after 72 hours of the last drink. 4. Delirium tremens. It usually occurs 48 hours after the last drink. What are the symptoms? Symptoms range from mild to severe and appear 6 hours to a few days after the last drink. It may worsen after 2 to 3 days and persist for weeks. They include insomnia, problems with falling or staying asleep, tremors or shaking, nausea and vomiting, a headache, anxiety. A severe form is delirium tremens, characterized by extreme confusion, fever, tactile, visual, and auditory hallucinations. Withdrawal seizures. Generalized tonic-clonic seizures commonly seen within 72 hours of stopping or reducing alcohol consumption. Auditory or visual hallucination without delirium. Causes. Reduction of the amount being consumed or stoppage of alcohol after a prolonged drinking period causes alcohol withdrawal syndrome. The central nervous system adapts to alcohol over time. Upon sudden reduction or stopping, it experiences difficulty in adjusting to the lack thereof. Diagnosis. Diagnosis begins with a review of medical history and examination of the physical and mental signs. Physical examination. The physician looks for signs of tremors, irregular heart rate, fever, loss of orientation, seizures, etc. Toxicology screening. To check the amount of alcohol in the body. Cognitive assessment. Doctor asks simple questions to assess the mental status of the individual. Treatments. Treatment depends on the severity of symptoms, alcohol consumption pattern, and the amount of alcohol consumed. The goal of treatment is to reduce symptoms and provide counseling and medications which encourage the patient to stop drinking. Medication. Intravenous and intramuscular therapy. To prevent dehydration and to manage acute aggression. Common fluids to administer: normal saline, NS, Ringer's lactate solution, RL, dextrose normal saline, DNS. Sedatives. Help the person recover faster. Common sedatives drugs: lorazepam, diazepam, oxazepam, clonazepam. Dietary supplements. To replenish lost vitamins. Common vitamins: vitamin C, thiamine, niacin. Antipsychotic mild doses helps to control hallucinations. Common antipsychotic drugs: risperidone, haloperidol. Complications. Residual psychosis. Cardiovascular collapse. Prevention. Avoid heavy and/or regular drinking. Questions to ask your doctor. How long should I continue treatment? How long will the symptoms last? What are the health problems linked to alcohol withdrawal? Nutrition. Foods to eat. Calcium-rich foods like dairy products, milk, sardines, broccoli, and cheese. Carbohydrate-rich foods like grains, bread, and potatoes. Protein-rich foods like egg and milk. Vitamins and mineral-rich foods such as fruits, leafy vegetables, oatmeal, and carrots. Foods to avoid. Caffeinated beverages like tea and coffee. Carbonated beverages like soda. Finally, alcohol withdrawal is serious, but with the right support, recovery is possible. Know the signs, seek help early, and prioritize your health. Thanks for watching. Please comment, share, and subscribe for more.